Paul, thanks for joining us here. I have Paul Chapman, who is founder and executive director of Restore Hope, one of our key partners in this ecosystem approach of our three priorities, trying to really, at the end of the day, it is reforming child welfare. It is saying the only way to do this is private and public. Like there is no way that the government solves this on its own, and there's no way that the community does it by itself because of how the ecosystem is created. And with those regulatory side of things with the government, we got to break those walls down, right? And you guys have been doing that for a good little bit now. I mean, you don't have to tell the whole story, but you guys really focus on how do we really serve these birth parents? Like, how do we prevent them from ever having the government interact and preserve and then reunify and empowering the professional community and even some of the lay community to be a part of that? I would love for you to share, what are you excited about that's happening in Arkansas right now? And then with that, what kind of innovations do you see coming in the next maybe year with HopeHub, 100 Families, Restore Hope, technology-wise that you guys are working on that's going to blow this thing up even more? So love to kind of talk about those two things to start.
Yeah. So, our solution is all built off the theory of this collective impact that folks that are in crisis, families that are in crisis, require more help and coordination than any one organization could give.
Yeah.
But like you said, you have to have the government, if they're involved in child welfare or parole or probation, or even got a speeding ticket and can't pay, they're on their way to real trouble.
Yeah.
It's expensive and hard to get out of. And so how do you align all the different stakeholders that individual may need in their lives, coordinating all these actions? And then what we've seen is when you can do that, you get much better results.
Yeah. And it's a lot more than people think. Like most people think, like this one nonprofit could just come around that family and they're good to go and they'll just navigate them around. It's a lot more than people ever could imagine.
I'll tell you, our journey in getting there is I left financial technology to go work for Fellowship Bible Church in Little Rock and oversee the funding and direct service that we're doing locally, largely for reentry and foster care. And even with all of our influence, which was considerable, and our money, we came to the end of a series of innovations and partnerships where like, it's not enough. And even though we were helping people, we weren't changing the system didn't change.
Yeah.
And everyone that we were partnering with felt that. And so you would have kind of these meta moves that the economy would go down, like the financial crisis, and then all of a sudden crisis goes up and folks, and that results in different things in school. Your perspective matters, right? If you're in school, you're seeing kids, their grades decreasing and behaviors and absentees increasing. We're more people in jail, more people in prison, more people in child welfare. And so how do you actually align? How do you put a team, the right team for the individual at the right time? And all pulling together in the same way. It increases what we've seen is it increases public safety, which we all want and is absolutely essential. And that it drastically increases the ability of the person to actually get out of that trouble and then get on, we call it crisis to career.
Yeah.
How do you start that journey where you're in multiple areas of crisis? Maybe you're homeless and you don't have a high school diploma, you have children, and now you've just gotten into a little bit of trouble. And how do you surround that person? Not only get them out of trouble and maybe into an educational situation, but onto career where it's much less likely that they would ever recidivate into any.
And they become a thriving member of community who helps other community members, right? I've seen that, seen those who have gone and gotten the help and now are on the other side helping others get out. It's incredible. So tell me this, in the last 12 months, what has been some of the most exciting things that have happened in the last 12 months with the work that's going on?
Yeah, so last 12 months in Arkansas alone, there are 19 counties that are using this collaborative model. There are 1,400 different professionals using the software to collaborate. 1,400. That's government and non-government individuals who are all professional, therapists, substance abuse, food pantries, all the way to workforce delivering. So you've got schools that are on here. And so 3,400 families, and we're seeing massive moves in stability, for financial stability, for housing, for employment. And if you're looking at like reunification rates, if we have to take a child into foster care in Arkansas, they're probably not going back home, even though that's
41.5%, I think is, yeah.
And it was just over 70% in the last 12 months, if they'll work in this collaborative way. And so kids are getting to go back home because the parent has settled all of those things that were causing a danger to the child.
30% is in those counties you're working in, is a 30% higher probability that you're going to get to be reunified. That's insane. 41% from the government side without having 100 families working, to 75%, I think is what I saw last week.
Last 12 months. Yep.
Which is just crazy. So, just population level change.
Jared, if I could say this too, the dashboards that we're producing off of the software, these 1,400 people and their interactions, and the client gets a update in this very thorough assessment every month. And so you see progress or regress across 13 areas. We aggregate all of that data and provide it to various leaders. So your local leaders, your stakeholders, all the way up to state leadership. And what we're seeing are better, more informed decisions being made by others, including law enforcement. And it changes the first people that hope is restored for are actually the professionals in the field. You may be 25 years in law enforcement and you're like, I wish things could change, but they don't.
Right.
They could change.
And now
so therefore we're going to make some decisions and we're going to trust the community is going to be there in a coordinated way if we're using our discretion.
Give me 3 or 4 things that you and the team are most excited about that you're starting to work on and innovating in the platform.
Yeah, well, we just rolled out an innovation with a partner of ours, Care Portal. Now, any point of contact or someone that's a primary user onboarding clients into HopeHub can now create needs in Care Portal. So now HopeHub organizes the professional community, and Care Portal is organizing the church or the non-professional volunteer community, and now those two are overlapping. And we're seeing really, really neat outcomes there, but also we're able to provide Care Portal with some additional data so they can go back to their stakeholders and say, here was the journey that mom was on that you provided beds for or helped fix her car so she could get to work. And
that's great.
Some of the other things that we're doing is trying to, every family advocate who is a person in a community that onboards the client and connects them with the rest of that community stakeholders, they can serve about 100 families in a given year.
Yeah.
So we're starting to roll out some innovations now that make it more likely that they could have the same impact on families, but serve more. And so we have a whole roadmap for how we can continue to increase that until maybe one day, this is kind of the dream, is one day we could actually make that available to different government and social folks out there where it's not such a heavy lift.
Yeah.
And maybe you could onboard people and do your other job, which would that'd be a huge change for the number of clients.
It's a dream pipeline.
That's the dream.
Right. Well,
that's where we're headed.
Get there sooner rather than later.
That's right.
Well, tell me this. We've been having a lot of conversation with a lot of states. We did a vision tour to Arkansas in January where we brought 5 different states, got to come see it. Where do you see the greatest momentum? We know there's 2 that are already looking at signing letters of intent. So I'd love for you to share those 2.
Right.
And those are probably the 2 for this year, we think.
Right.
What other states are you you're willing to share where you just feel like, man, 4 others and Restore Hope have momentum here?
Yeah. What's been so great about this partnership is, beyond the funding, which is essential, especially for us to build capacity. But the cooperation, y'all going in and identifying state and talking with state leaders. You're not a vendor. You're there to help. You've created some tools to help them kind of think through what's felt need, what's real need. And then you could bring us in and we're not pitching like other vendors are. We actually have a true partnership now where the 3 entities, are sitting down and saying, is it preservation? Are you looking for prevention, preservation, or reunification? Where is that? And our highest and best need, the best dollars spent, the best time spent is is on that prevention piece. It's like if the government never knew the family's name, that's what they want.
Yeah.
They want those problems to be solved before some type of government action has to be taken. And so, it would just, I don't think it would have happened, without that partnership. So we're way down the road and about to start with Iowa.
Yep.
And so we will launch, it looks like, in 7 counties in Iowa this summer.
7, which normally you start in 3.
In 3.
But they're just like, we're going.
They already had some efforts going.
Yeah.
All the state leaders we're talking to, they all know what needs to happen.
Yeah.
That fragmentation of our services and the fragmentation of the funding of services is part of the reason why the collaborate. It's like a builder. You would never attempt to build a structure without the builder being able to pull permits and react and pull in the different experts at the same time. But that doesn't happen in human services. So all these state leaders, they realize what the problem is, and they're trying to innovate around that. And so Iowa had done that and was doing some real good. But when they looked at our tool set, like, that would fit perfectly. It would make what we already wanted to do go so much faster and further. Same with Louisiana. And so we'll probably by this fall, our end of year, we'll be in full operation, launching in Louisiana. And they had already started the same kind of thing, is how do we bring this partnership between the government agency and these local community providers. Anyone that catches a child welfare case, they've got government involvement. And I think that's right. The government should be the one who's deciding, do we take the kids or not? Yeah. But largely that's a community problem.
Right.
There's something devastating going on in this family, and the government cannot raise kids, and it cannot raise people. And therefore, it needs the community to surround them, and the individual clients that we're targeting do not have extended family or church family that is there for them. And so, essentially, what we're doing is we're mobilizing that for them.
Yeah, I love it. So, Iowa and Louisiana, I mean, it's onboarding. It's happening.
That's this year. Yeah,
and then I know there's other conversations happening. I know we've had it with some with Tennessee. There's things with Florida. There's things with Oklahoma. Alabama came to visit. Connecticut would love to try and figure it out and engage. People in Texas. So we just see God's doing something. He really is. And it's just really, we are humbled and honored to be a part of this with you. And then we're just so proud of the Restore Hope team and your board and how you guys have looked. And I love that we're going to take care of Arkansans, because that's our state. That's our backyard. So we feel about Tennessee. We're going to take care of Tennesseans because Tennessee's our backyard.
Yep.
But there is this, between with what you guys do and the contingent, there's this tide that we could go into states and help rise all the boats of that state with all the providers, all the nonprofits, all the community, all the churches to solve this problem. So Paul, we just thank you for what you guys are doing. We're so grateful for Sarah and Karen and Tyler and all those guys that are working hard. And man, thanks for being here and being able to share a little bit with our group.
Yeah, thank you so much. Couldn't do it without y'all.